Hello, and welcome to our very important discussion today on cystic fibrosis. Cystic fibrosis. It's very important to understand cystic fibrosis because it is one of the most debilitating genetic disorders that affect the process of transmembrane transport of solutes. So, we're going to be learning today about the pathogenesis of cystic fibrosis, what causes cystic fibrosis, and why was it called cystic fibrosis? Although the main feature, the main signs and symptoms of cystic fibrosis are not really related to the formation of cysts or scar tissue or fibers. And the reason for that is because it was first found when cystic fibrosis was first detected and found. It was found in the pancreas, and there were cysts, balloons, bubbles. There were cysts that were in scar tissue and fibers. That's why they were called cystic fibrosis, but it's much bigger than that. And we will see that cystic fibrosis is, um, in fact, a multi-system disorder that affects the respiratory system. It affects the integument, the skin. It also affects the pancreas, the excretory ducts of the pancreas. The cystic fibrosis also affects the bile duct, the canaliculi of the bile. It affects also the intestines and also the small intestine and the large intestine alike. Small intestine will no longer be able to absorb the lipid soluble vitamins A, D, E, and K. And also, we will see that these patients of cystic fibrosis will have mostly the neonates, the babies, would have a very engorged intestine with a fecal matter that is devoid of water and very thick and greasy meconium. So we will get into that. But what we must begin with is that cystic fibrosis is a defect in the transport of chloride. So there will be absence, complete absence, or the chloride channels would be present on the cell membrane, but they will not be able to do their